Hi, this is Scott Kreitzberg with Kreitzberg Plastic Surgery. I'm a board certified plastic surgeon here in Tulsa, Oklahoma. Today I want to talk about saline and silicone gel implants. So a saline implant will typically come as a shell. That shell we then fill in the OR. Some people will fill it outside of the breast. Some people will fill it once it's inside of the breast. The basics to it is that there's a fill port that goes on the top side of the implant. We typically will hook it up to a tubing. That tubing will then be connected to an IV with saline that we're able to draw and push into the implant. So typically it kind of pushes in like this. Once it's pushed in, the implant enlarges till you get to a set size that you want. Now these implants, they can be adjusted by roughly 50 to 70 cc's while you're in the OR. They do come in designed sizes and shapes. So there are ones that are very tall, ones that are flatter and wider. And we choose these shells based on the parameters what the patient wants. But then we have the ability to make slight adjustments in the OR based on what we see. Now, when we talk about a silicone implant comes like this. It is pre-filled. We don't fill anything. We simply put this implant into the breast. There are multiple different sizes and shapes to silicone implants. How do we get around sizing in the OR? Is a lot of us will utilize, and myself included, will utilize a sizer in the OR in which I can quickly adjust, and it's roughly the same diameter and in shape as the implant I'm going to put in. Once I get to the right size, then I can choose between 2 or 3 different pre-filled implants and put that implant directly into the breast. Now, the other thing that we should know about saline and silicone implants is typically people will find that a silicone implant will feel more natural. It has more of a uniform feel kind of throughout the implant. When you go with a saline implant, a lot of times you can feel a little bit more of a firm feel, and you can feel a little bit more of the edge of the implant. Now, if there was a rupture of the implant, if you have a saline implant, it's simply like we're removing fluid. It goes flat. And that's how it goes with the saline implant. With the silicone implant, typically they're designed now to be gummy bear implants. They have silicone gel that is highly cohesive. With that highly cohesive gel, it maintains its shape. So if I was to cut into this implant, I'm not going to see silicone gel basically pour out like honey or anything like that. It will stay in its routine shape. So this is a silicone gel implant that's cut in half. As you can see, it maintains its shape similar to if you were to cut a gummy bear in half. So that's how it got nicknamed a gummy bear implant. If you have more questions about saline or silicone implants, please give our office a call. I'd be happy to see you in consultation. Thanks. Bye.